Good afternoon, everybody. I want to provide a special CEO briefing that's focused exclusively on the COVID-19 crisis. It's clear that this country is now in a state of war. Right now, we're seeing a significant, exponential growth in the number of patients who are testing positive for COVID-19. We also are seeing, unfortunately, a rapid growth in the number of patients who are succumbing to the disease. As bad as it is now, and it's really bad, it's going to get worse. In about 2 weeks or so, we're going to see a peak in this crisis, and we're going to see a level of strain on healthcare services in this country that we have never seen before. CRNAs right now, and increasingly in the future, in the very near future, are going to be on the front lines of this war. So I want to share with you some of the work that we're doing within the AANA to support you and the patients that you are taking care of. First, because this is a war, we need to move as aggressively as we can to removing barriers for the full utilization of nurse anesthetists. Just yesterday, you likely heard that CMS has temporarily suspended the physician supervision requirement for nurse anesthetists through a Medicare payment policy. We think that's a great move. And in fact, when I was at the White House a couple weeks ago, I advocated for that with President Trump, Vice President Pence, and CMS Administrator Verma. We are now advocating for that to be a permanent fix. We're working with the White House, Health and Human Services, and CMS to make that so. We're working within the VA to support them because we know that they're going to be profoundly impacted. And we think now is the time, it's past time, for full practice authority for nurse anesthetists in the VA. We're working with our colleagues at the state level, our state association leaders, who are moving aggressively through executive action by their governors to remove all barriers for the full utilization of nurse anesthetists. We've had a lot of success. We're going to have more. If you go to our website, and I strongly encourage you to go to the website for any resource that you may need on this issue. On the front page, you'll see the COVID-19 banner. Click that, and you'll find all kinds of resources. Clinical resources, employment resources, advocacy resources, and much, much more. We know because of the valuable role that we have and our background as critical care nurses, CRNAs are increasingly being moved into enhanced APRN roles within the hospital. We've created job descriptions and other resources to support that. We've provided and we will continue to provide resources on billing to support that as well. We know that many CRNAs have been displaced because of this crisis. With elective surgery all but gone for the foreseeable future, many CRNAs are being furloughed and terminated. We've worked in partnership with the VA to create an innovative partnership where CRNAs are now moving into the VA for a temporary basis to provide services as advanced practice registered nurses. We already have 300 CRNAs who've moved in the pipeline in just a couple days. We'll continue to work on that and other innovative solutions to support you during this crisis. I want to end this video as a thank you. I'm in Park Ridge right now in my office, and I'm the only person in the headquarters, which is surreal. And I want to thank, on behalf of the staff and the board of directors who've been amazing through this, and myself, I want to thank you for everything that you're doing right now. We know that these are very difficult times. We know, as I said earlier, that things are going to get worse before they get better. But things are going to get better. And we will work together as a team. And CRNAs are going to be a huge part of saving lives. So, please let me know how we can better service you. What are your needs? How can the AANA address your problems? Please let us know. You can put comments in the social media platform that you're viewing this on. And we will absolutely review those and make all the necessary adjustments we need to make to best support you. So, again, from the bottom of my heart, I want to thank you for everything that you're doing. And I know that we will get through this together.